My name is Ayana Nicole Chirihuayo Palis, and the topic to be discussed is the impact of chemotherapy on the neuromuscular components of Gait.
Definitions. Chemotherapy in use of drugs to destroy cancer cells is work by preventing cancer cells from growing and dividing into more cells because cancer cells usually grow and divide faster than normal cells. Chemotherapy has great effect on cancer cells. However, the drugs used for chemotherapy are strong and can damage healthy cells anyways.
I'm Dr. Susan Love, and I'm Chief Visionary Officer of the Dr. Susan Love Research Foundation. Our mission is a future without breast cancer, and we do that through innovative research into the cause and prevention of the disease. Inpatient Science is a series of videos that we've made to help you understand your diagnosis and the treatment choices that you have.
As we improve outcomes for many breast cancer patients, more research is being done into the short and long-term side effects of treatment, the collateral damage. It is well known that cancer treatments can cause temporary side effects. With surgery comes postoperative pain, and with radiation, your skin can turn red. Chemotherapy causes hair loss, nausea, fatigue, and mouth sores, while hormone therapy can bring hot flashes or joint pain.
Nobody may have told you that there can be permanent, long-term changes to your body as a consequence of treatment. It's like fixing your car after a crash. It may run fine, but the passenger door will never close the same way as it did before the accident.
Collateral damage can take many forms. It can appear as lymphedema, which is pain and swelling in an arm or hand, or as peripheral neuropathy, a type of nerve damage that causes pain and numbness in the hands or feet. You might also experience chemobrain, a term often used to describe changes in memory and thinking.
A lot of times, these problems are overlooked and they aren't talked about that much. As a patient, you feel lucky to be alive, but it would be even better to have your brain fully functional and your feet not hurting.
Other collateral damage can include depression, anxiety, fatigue, sexual problems, and permanent loss of sensation in your reconstructed breast.
Because this damage is often underreported in metastatic patients, we started our Metastatic Breast Cancer Collateral Damage Project. In it, we asked people living with metastatic disease to tell us what they were experiencing in their own words. We've learned from hundreds of responses that there are many problems that remain unaddressed.
Some of the Foundation's recommendations are to raise awareness of palliative care, improve access to clinical trials, and provide resources for financial assistance, fertility, and sexuality support, amongst others. You can learn more about our Metastatic Breast Cancer Collateral Damage Project and participate if eligible on our website.
Our mission at the Dr. Susan Love Research Foundation is a future without breast cancer, and we do this through innovative research into the cause and prevention of the disease. You can join us at drsusanloveresearch.org to participate in our research or to help fund our research, because together, and it's going to take all of us, we can be the generation that ends breast cancer.
Applications in physical therapy. The purpose of physical therapy is the study of human body movement and its maintenance, recovery, and rehabilitations in any of its alterations in order to achieve its integral rehabilitation and contribute to a better quality of life and human interaction with the environment.
There's days that I can't get out of bed because my body just hurts so bad, and you're on so many, not only chemo medication, but you're on different home medications.
I'm Laura Bleck, and I've been a physical therapist in the Valley since 1998. And at that time, my former employer had a bunch of us therapists lymphedema certified.
Originally, I started coming because I had a small case of lymphedema, so I thought that's all that I was going to be working on was my right arm, and that was it. But we've been working on strengthening, getting my, like heart rate up for cardio, and it's helping me just try to get my strength and energy back. Instead of having to lay in bed all day long, now I can get out and do something. And I snowblowed the last 2 days, and there's probably no way I would have been able to do that if I didn't have the program.
So when the Fox Valley Hematology and Oncology group decided to come this way, we asked if we could be part of their rehab services to offer truly a full, comprehensive care for their patients.
I've gone through different physical therapy before for all sorts of different things like neck injuries, wrist injuries, and she just has that really good personality, kind of like I've been able to kind of open up to her and talk about our families and stuff like that. Just kind of made it feel warm and welcome, like a place that you actually want to come to, instead of like, oh, this is another appointment I got to sit through for like an hour.
Over the years, working with the cancer population has just, it's been such a rewarding experience that we wanted to do something more for the Valley and truly meet all of their needs. There's studies that show, 65 to 85% of cancer patients will have some sort of functional impairment following their cancer treatment. And as cancer gets looked at more as a chronic disease, it's definitely important that we get these patients in so they can return to their normal jobs, or if they're mothers that have young children at home, that they can be as active with those kids as possible. And so we definitely can help more than just the patient who has that chronic swelling. We can help patients just get back to their normal quality of life.
Pros and cons. Pros. Improve physical strength. This can compensate for limitations caused by cancer and cancer treatment, achieve good posture and optimal function, improve exercise tolerance, and minimize fatigue. Cons. Anxiety, depression, sleep disturbance, anemia, fertility problems. It should apply in Ecuador. Oncology pain is a sensory subject and unpleasant manifestation that may be due to a real potential injury derived from cancer and or its treatment. Its optimal maintenance is complex, recurring, and multidimensional approach. Pain is a frequency problem in these patients with a prevalence of 80% in advanced stage. At the time of oncology diagnostic, patient might present pain from 20 and 50%. Conclusion. We conclude that a well-planned physiotherapy treatment adapted to each patient can help to reduce this pain and pain, improve lung capacity, reduce the side effects of the intervention, prevent new recurrence, and reduce both morbidity and mortality.